We had a mass carbon monoxide poisoning in New Orleans where I think it was 26 people were poisoned at a printing company. And in the most bizarre way, at 3 different hospitals that I had been rotating at and doing the hyperbaric oxygen at, I ended up treating all of these individuals at one point or another, some acutely and some with delay. Because these were always so disputed, I had done brain imaging on all of them, functional brain imaging, to help in the diagnosis and documentation of their carbon monoxide poisoning and any residual effects that may be there. And then, of course, I re-imaged them after I had treated them. And then we had some with delayed treatment that we imaged before and after, and all the functional imaging was consistent and showed improvement. As you can imagine, happening in a business setting, lawsuits and all the rest of that, liability and so on. The Deep Pockets defendant was a printing press company that had come to New Orleans. That what had happened, this printing company had bought new printing presses out of Germany, and installers were hired out of Atlanta who trucked it to New Orleans and installed it in the printing company. They did this with a propane-powered forklift operating indoors in this, I don't know, maybe 25 by 40-foot room. The propane-powered forklift had not been properly tuned. It was way out of tune, and it was pouring out carbon monoxide. Everybody in the building got poisoned. And the 2 most severely poisoned were the forklift operators who collapsed. One was unconscious. But everybody got poisoned. Anyways, I ended up treating them all. The lawsuits ended up getting filed, and the printing press company had given $1 million to 3 defense firms in New Orleans and told them, make this go away. Settle it, do what you need to do. You got $1 million to work with. And what it finally boiled down to was an arbitration hearing. It ended up in arbitration, and there were 19 attorneys that came to this meeting with the arbitration judge. And I was asked to come because I was the treating doctor and had done all this imaging and show the medical records. And so I walked in and they asked me to present what you did. And I showed the imaging, and they passed around the imaging for all of these patients. And what it showed was a very injured pattern of brain blood flow that improved after the hyperbaric oxygen, and essentially unequivocally showed there was brain injury. And when the defense attorneys saw this, they realized they had no argument. They were trying to claim that most of the patients had minimal exposure. There was no injury from it. Nothing was wrong with any of them. And as the arbitration hearing concluded immediately after I showed that imaging, the attorneys just said, we're done here, plaintiff's attorneys. Here's the evidence. As everybody got up and walked out, the defense attorneys went to the plaintiff attorneys and said, our whole defense is shot. You leave us no choice. We're going to destroy Dr. Harch's reputation and career. And they walked out of the room. I didn't hear that. The plaintiff's attorneys came to me and said, we just want to warn you, you may need to get an attorney. They are coming after you. And they said that they're going to destroy your reputation and career. And what they initially tried to do was include me on the lawsuit. But they couldn't do that because, meaning third party sue me, they couldn't do that because I'd already given a deposition in the case and they hadn't informed me that I would be the object of a lawsuit. So they got individuals in there to file charges against me for experimenting on these patients, for essentially treating them. And that started what became years of internal fighting and very dirty politics for ultimately this very clean medicine and the obstruction of the advancement of this for patients with neurological injury.